podcast episode is based off a blog post called Pharmaceuticals and Nutrient Deficiencies, published on February 1st, 2023. We've all heard of side effects. When you really think about it, you could make the argument that there actually is no such thing. An effect is an effect, so whether you want it, a desired effect, or don't, a side effect, there it is. Whether we call side effects, or just call them what they are, effects, let's take a look at a commonly overlooked effect of many pharmaceutical drugs. But first, let's agree that there are different ways drugs can create their undesired effects, directly and indirectly. Let's look at some examples. Here's one of a direct effect. You take your antihistamine allergy medication and it makes you drowsy. This is an expected and direct side effect. Histamines can cause runny nose and other allergy symptoms, but they also keep us feeling awake and alert. Blocking them thus can dry up that runny nose, but also make you sleepy. Here's an example of an indirect effect. You take your oral contraceptive pill very regularly like you have for years. You've noticed that slowly you have less pep in your step, and you can't seem to keep up with your peers during activities. Your B vitamin levels are likely to have been slowly declining over years of OCP use, and now, as an indirect side effect of these pills, you have vitamin B deficiency and long-standing fatigue. These are just two examples, but there are so many. What many people don't realize is that pharmaceutical drugs tend to deplete our stores of certain essential nutrients. Without enough of whichever nutrient or nutrients has been depleted, we either can't stay healthy when bugs go around, vitamin C deficiency, or can't heal well from cuts and scrapes, zinc deficiency, or can't keep our energy up, which could be a B vitamin deficiency, etc., etc. These are simplified examples as nutrients each play multiple roles and many of their functions overlap, but you get the idea. This is why, if you've been prescribed statins, your doctor also likely advised that you take CoQ10. Statins deplete this coenzyme, and without it, the heart can't function as well. Ironic, since most people take statins to lower cholesterol, with the intention of reducing cardiovascular disease risk, which itself is controversial, but I digress. Fortunately, the need for CoQ10 supplementation during statin use has been widely recognized, and this need addressed in clinical practice. Unfortunately, this is one of very few nutrient-depleting drugs which tends to come recommended alongside the nutrient it depletes. A very commonly used medication in the U.S. is oral contraceptive pills, as just mentioned. A great many of my patients and clients are on or have been on OCPs, and a great majority of those have never been told that they should be supplementing with the multitude of nutrients OCPs deplete. It's one thing to screen for those direct side effects, those things we can read off the info pamphlet which comes with our prescriptions. It's another to dig a little deeper and find out whether there is a link between someone's symptoms and a medication they're taking, not because of the well-spelled-out side effects themselves, but because of a downstream physiological effect of taking that drug. More doctors and patients need to be informed and take action around this. If you're taking prescription drugs and want to know whether what you're on could be causing nutrient deficiencies, check out the link to the website which is in the description of this podcast episode. It's user-friendly with a quick search tab and a relatively large database of drugs. If you see that your medication is associated with certain vitamin or mineral depletions, consult with your doctor around the best way to 1. Test your nutrient status, and or 2. Replenish any nutrients which may indeed be depleted. There are so many individualized ways this topic could and should be addressed. It would be impossible to dive into them all here. Awareness is the first step, and if you come away from this episode realizing that you, your loved ones, or your patients on prescription medications might need to be replenishing nutrients that said medications may deplete, then mission accomplished. What questions do you have? Thanks for listening.